New York. 60 years ago, the U.S. Surgeon General issued a report that settled a long-running public debate about the dangers of smoking and led to major changes in smoking in America. Today, some public health experts say a similar report could help clear the air about e-cigarette use. Many U.S. adults believe that vaping nicotine is as harmful or more dangerous than smoking. The U.S. Food and Drug Administration and most scientists agree that, based on available evidence, e-cigarettes are much less dangerous than traditional cigarettes. However, this does not mean that e-cigarettes are harmless, and public health experts disagree on exactly how harmful or helpful the devices are. Lawrence Gostin, a public health law expert at Georgetown University, said clarifying information is urgently needed. There are a lot of confusing messages about vaping, Gostin said. A general surgeon's report could clear things up. One big hurdle: e-cigarettes haven't been around long enough for scientists to see whether they develop problems like lung cancer and heart disease. Dr. who directs Bloomberg Philanthropies' public health program. There is a striking lack of evidence, Henning said. Cigarette and vaping has long been identified as the leading cause of preventable death in the United States. The Centers for Disease Control and Prevention puts the annual death toll at 480,000. That number is expected to start falling around 2030, thanks part to declines in smoking rates that began the 1960s. According to a study published last year by the American Journal of Preventive Medicine. At the time, ashtrays were everywhere and more than 42% of U.S. adults smoked. On January 11, 1964, U.S. Surgeon General Luther Terry released a credible report saying that smoking causes disease and death and that the government should do something about it. In 2022, adult smoking rate was 11. Some experts believe e-cigarettes deserve some of the credit. The devices are advertised as a method to help smokers quit, and the FDA has authorized a handful of e-cigarettes as less harmful alternatives for adult smokers. The popularity of vaping exploded in the 2010s among adults and teenagers alike. In 2014, e-cigarettes overtook combustible cigarettes as the most used tobacco product by young people. As of 2019, 28 of high school students were using e-cigarettes. U.S. health officials are alarmed, fearing that children addicted to nicotine will rediscover smoking. Last year, the high school smoking was less than 2. This rate was much lower than the 35 seen approximately 25 years ago. This is a major public health victory. It's almost unbelievable, said Kenneth Warner, who studies tobacco control policies at the University of Michigan. If e-cigarettes didn't exist, I think we would hear public health community screaming at the top of their lungs about success of convincing kids not to smoke, he said. Benefits and harms of electronic cigarettes. Cigarettes have been called the